Hello friends, a big question I get asked a lot is how close can we hold the Bioptron to the body? Well, firstly, my name is William Bissett and I'm the Director of StimTech Medical and also the Bryland Functional Medicine Centres, and we are a official Bioptron agents, so we can sell Bioptrons, but we also have Bioptrons throughout our clinics as well, and we offer training to all our clients. So how close do you have the Bioptron? Well, according to Bioptron themselves, they say between 5 and 10 centimetres, but the reality of it is that I just hold it directly against the skin. And it's a lot easier. I see some poor people, they're trying to hold it a certain distance away for ages and it's hurting them. Just put it straight on. The reason why it's recommended to have some distance is because, first of all, the Bioptron was designed for really bad skin conditions, and also they're used in hospitals. So there has to be an antiseptic type distance between the patient, because you don't want to do this to one patient and then the next patient comes in, you put it on their skin as well. So the other thing too is, for example, every night I do 20 minutes yellow in my belly button, and I'm holding it on my belly button, and yellow, well, it gets hot after about 5 minutes, so I'm going to have a bit of a gap. So some of the lenses will actually sort of get warm or too warm after a period of time. Probably won't burn you, but you want to keep a bit of a distance. The other thing to bear in mind as well is that if you are actually working on a nasty skin condition or a fungi, you still probably wouldn't really want the Bioptron to be on it anyway. But fundamentally, for most conditions, particularly pain, arthritis, then sure, just point and shoot and put it directly on the skin is the easiest. Now, there are times where some people might want to do the Bioptron for 20 minutes, 40 minutes, an hour, or even 2 hours. And so you can actually maximize 40 centimeters is probably the maximum you'd ever want to do over a long period of time. What I'll do is in the links below, I will put a bit of information about duration and distance. Fundamentally, you're the doctor, so there's no hard and fast rules, so to speak. There are principles, and you're going to have to feel your own way about how you feel about whether you put it directly on your skin or put it far away enough. I've made other educational videos, and I'm going to be making more educational videos about how to use the Bioptron. We have links below, so please, subscribe to us, like our page, share it, or even leave us a comment.